you all know I'm a psychoanalyst, but I'm hoping that I think that people from other sort of psychotherapeutic disciplines, people who engage in CBT, somatic psychotherapy, psychoanalysis, people devoted to the conversational model, self-psychology, can all contribute to an understanding. And my hope really is to increase our understanding of very seriously disturbed patients. Because the reason I gave the talk at the Gold Coast is I've quite often noticed that when someone very severely disturbed comes to a psychiatrist, very often there's immediately a sort of a view that this person can't be helped with psychotherapy through sort of conversation, through communication. I'm not recommending in any way that I'm not wanting to put this forward instead of medication, but it's the view that in addition to medication, sometimes medication may not be necessary, that communicating with the patient has a healing function. And one can think really that all disturbance, severe disturbance, does originate probably through a breakdown of communication at a very early stage of infancy. I just want to say a little bit about when I use the word psychosis, I include schizophrenia, bipolar disorder, but also other personality disorders that aren't put under the heading of psychosis in the psychiatric textbook: addictions, psychopathy, borderline conditions, alcoholism, and so on. So what I'm really trying to look at is what the underlying pattern is that generates these different series of disorders. And it's not only that these patients come and quite often people don't think of possibly trying to treat them through communication, but it often happens also that psychologists, psychotherapists find themselves with a patient who is very severely disturbed, which they may not have realized when the person first presented themselves. So it's I'm not only sort of wanting to encourage you to take on these patients, but to think about, well, what happens when you do find that you do have such a patient. However, I am asking you to do something which is very disturbing. It's very disturbing emotionally, and also can be a huge burden. And in fact, one of the diagnostic signs of psychosis or primitive disturbance is the anxiety that it stirs up in those around the person. Quite often, the sort of recipe that's given is don't get involved. But if you follow this advice, then you'll certainly not want to treat these patients, because you cannot, in fact, treat patients of this sort without being involved in a disturbing process. So you might ask, well, what's the reward for doing this? Is there any advantage in taking on patients of this sort? And I think really the answer is the reward lies in understanding. When you understand something, it can bring with it a deep contentment but also it can bring a very sort of frightening picture of one's own insensitivity, brutality, guilt, shame. But also, if understanding opens, it does open understanding to a broader sort of spectrum. So it may throw light, for instance, onto the phenomenon of terrorism, war, religion, racism, and so on. So it's a question really of whether you are sort of fired by that type of curiosity for understanding. And I'll just quote to you from an article that appeared recently in the International Journal of Psychoanalysis. It's an article of Thomas Ogden's, which he entitled Reading Harold Searles. Harold Searles was probably the analyst who had perhaps one of the greatest understandings of these more disturbed patients. Thomas Ogden wrote this article, Reading Harold Searles, where he tries to get a sort of an understanding of Harold Searles's attitude and way of working with these patients. Thomas Ogden says, Searles believes, on the basis of his extensive psychotherapeutic work at Chestnut Lodge, that the analysis of schizophrenic patients and other patients suffering from psychological illnesses that have their origin in very early life affords a particularly fruitful way of learning about the nature of experience that is common to all humankind. Searles believes that successful analytic work with such patients leads to an analytic relationship in which the most mature aspects of development, including the resolution of the Oedipus complex, are not only experienced and verbalized, but they have a clarity and an intensity, both in the transference and the countertransference, that is rare in work with healthier patients. And I would completely endorse that. Very early in my career, I found myself with a very severely disturbed young woman who was hallucinating in the consulting room. And through treating her, I learned more about psychoanalysis and psychotherapy than from treating many other patients. And it gave me an understanding that I don't think I ever would have had I not had that experience. But I do want to also emphasize this path is not for everyone. There will be some who may want to go in this direction, who have that sort of curiosity to understand, but there may be some who don't. A flying instructor once told me, he said some people who are wanting to learn to fly, pilots, just want to know what to do and how it works. But he said there are some others who want to know why it works and how the altimeter works and how different things work. And he said to me, both these are equally valid. And so it's a question really of whether there's that sort of, if you have that type of curiosity to understand, then you'll want to go in that direction. And what I'm really wanting to emphasize in this talk is to try and grasp an understanding of the condition. Quite often I notice, and even from reading articles, and I was sort of reading an article like this just recently, there's a lot of sort of discussion of what is said and what is said back and so on, but quite often the sort of psychological understanding isn't really sought. My own view is that it's very difficult to get somewhere with these patients unless there's some expansion of our understanding of the sort of mental life.